dengue is a very widespread, perhaps one of the most widespread mosquito-borne virus infections. So if you're going to holidays overseas in tropical, subtropical countries with mosquitoes flying around, you've got to be careful about dengue. Just try to avoid getting bitten by mosquitoes. The best way is to use mosquito repellent, wear long sleeves and long trousers. I know this is a pain because you want to get a suntan, but if you do expose your skin, particularly in the early morning and late evening, the mosquitoes tend to bite. And in fact, now there's several species of mosquito that can carry dengue, and they can bite during the day as well. The symptoms usually start around 4 to 7 days after getting bitten by a dengue-infected mosquito. They start with fever, malaise, flu-like illness, and then you may get a rash. And the rash is very fine, red, non-itchy, and you may start to get joint pains a few days after this. Muscle pain and joint pains are very typical in dengue, and particularly the pain behind the eye. This is so-called retroorbital pain, is very common with dengue, as well as headaches. And over 90% of cases, the symptoms go away after about 1 to 2 weeks. Occasionally they may persist longer. There's no treatment for dengue. Most of you will be fine. You just have classic dengue, which is self-limiting. You can take some paracetamol or other analgesics and just rest, and you should be fine after 1 to 2 weeks. If you're on holiday, this is a bit of a pain because you will be feeling unwell for at least a week possibly, maybe longer, and it depends on how your immune system reacts to the virus, and this varies between different people. There is a vaccine, but it's not normally used for travellers, foreign travellers to these endemic countries. You rarely see the complications of dengue, so-called dengue hemorrhagic fever and dengue shock syndrome. These are rare complications that happen in some people, particularly those who have been exposed to dengue before.